This is a type 2 tooth resorption, stage 4 out of 5. It means that almost all of the crown is gone, but as you can see, there are some spikes sticking through the gingiva causing inflammation and redness. So we have to shave those spikes down. If we decide to wait until it dissolves by itself, it could take months, and we don't want the cat to be in discomfort for that long. So you use your size 15 scalpel to gently make an envelope flap, so no releasing incisions, vertical releasing incisions, just an envelope flap. Now you use a small feline periosteal elevator to gently pry that attached gingiva away, so you can get your burr in there without damaging the gingiva too much. You are allowed to release a little bit of the gingiva on that healthy tooth next to it. Just don't go past the furcation and release that, because it will be harder to reattach in that area. So just make it nice and loose. It doesn't have to be a full flap, just enough to get that gingiva away. Now release a little bit on the lingual side also. Okay, so now you can use your burr without damaging the soft tissues. Here I'm using a diamond burr. You can use any type of diamond burr, round burr, football shaped burr. As long as it's a diamond burr, I don't recommend using the round steel burrs, because if you touch the gingiva or mucosa, it will destroy it and make a hole in it. But this one, if you touch the gingiva, nothing happens. It will just push it a little bit away and gently abrade the surface, but it will not damage it. So just make sure you smooth everything out, make it nice and smooth and soft, so there are no pointy edges sticking through that gingiva. So now you check with an X-ray to see how it looks. And as we can see here, that we nicely shaved down any crowns, and what's left is just resorbed roots that has turned into bone. I'm using a monocryl 50 suture. It's purple dyed, so it's easier to see, on a reverse cutting P3 needle. So you just need to take put a couple of stitches. Make sure to place them 3 millimeters apart, and that you take a good enough bite off that gingiva. Should be at least 3 millimeters also. And that's part of the reason why we also like to make the envelope flap and release it, is because if the gingiva has not been released from the bone, you cannot put your suture through it, because it will be stuck to the bone. The last suture here is just going to be a cruciate type with one knot in the middle.